So I'd like to now introduce you to someone. Hello. Can you hear me, Dr. Armstrong?
Yes, I can.
Great. So
Can you hear me okay?
Yes, perfectly. And I just want to introduce everyone. This is Dr. Tony Armstrong. He is an OB/GYN in Toledo. So he's going to tell you a little bit about what's on the front lines. He's the son, actually, of joined early in his career his father's practice in OB/GYN. His mom was a federal judge here in Ohio. But most recently, he is the president of OSMA. It is the Ohio State Medical Association, which works closely with the AMA. And we've asked him to talk a little bit about what he is seeing on the front lines in terms of something that is something we all worry about, which are the social determinants of health, some racial disparities, and making sure that we're not leaving anyone behind. We know, Dr. Armstrong, that we've had disparities in health way before we ever faced COVID-19 and coronavirus. But we are now learning that the fatality rate is disproportionate in the African American and Latino communities. And I'd love you to share more about why you think this may be the case.
Well, there's still a lot of unanswered questions. But historically in this country, there's always been disparities, unfortunately, in healthcare and disparities in terms of access to quality healthcare as well. Generally speaking, African Americans, people of color, and from impoverished areas, they tend to not see doctors regularly. And so they may have, as we refer to as comorbidities, whether that's obesity, hypertension, etc., that become neglected over time. Poor nutritional habits, and all these things may contribute to their overall susceptibility that if they do get this virus, that the outcome is likely to be very poor. Also, historically, because of underlying fears, they also tend not to access the healthcare system until they are generally very sick. And then their outcomes obviously are not going to be as optimum as if they got early entry into the healthcare system, whether it's from this virus or other chronic illnesses.
Thank you. Tell me more about, some of the messaging out in the community. Some folks have felt that perhaps that they're not susceptible to this virus. And do you think we're doing a good enough job, in our public health messaging, and how could we do better?
Well, very good. And some of the early messaging when the pandemic was starting to hit the United States, there were some myths that were quickly dispelled. And some of those are generational, and some of those may be cultural. In the African American community, there was this misperception that I can't get the illness. And then generationally, we saw the spring breakers dancing on the beaches in Florida, thinking that they were immune to the virus as well. And of course, we know that this is quite the opposite. There's also this perception of severity that if I do get the virus, that my outcome, depending on your generation or your cultural beliefs, that your outcome may not be poor. And so you may have a healthcare behavior that may put not just yourself at risk, but the others around you. And so I think the messaging that's being done and the social distancing and Governor DeWine's order to stay at home and the quarantining, we're starting to see that that's working. And so, in some areas, it's harder to reach people with that message. And a lot of people get messaging about healthcare through their schools and through their places of faith. And of course, now those aren't accessible. So I think we're doing a good job. I think actually we're doing a fantastic job in Ohio, and it'll take a little bit of time, but it seems to be working.
So I think you are working in the near Detroit area in Toledo. Some people are wondering about how they best access health care. What messages would you give to folks about getting access to care, and what are you seeing kind of on the ground in Toledo?
Well, a couple things there. The first thing is about access, and we're using a lot of telehealth in Ohio, and specifically using a smartphone or an iPad, having visual audio visits. If you don't have an established physician, most practices are taking on new patients, and if you don't have a smartphone or an iPad, then you can also use a laptop, and you can do what we call e-visits, where you can message your doctor and say, these are the symptoms that I'm having, and the doctor messages back with instructions of what you should do. The other thing is a lot of people still have the old flip phone, especially some of the elderly population, and we still do the old-fashioned telephone call. And then there's a process that generally you go through where they'll sort of screen with whatever your symptoms are and instruct you if this is something that they can take care of through an electronic prescription. Is this something that you have to have a face-to-face in the office, or do they have to direct you to an acute care facility?
So, this is a time when we know our safety net, our social safety net is struggling. Our food banks, our nonprofits that typically reach out to disenfranchised communities, they're struggling as well, as our businesses are struggling right now. So are there any words of advice or thoughts you have? Because I know this is a local response. It takes whole communities to come together. Do you have any advice and maybe words you'd like to leave with communities of color?
Well, the first thing is that, to access health care, particularly when you need it, and then adhere to the message that Governor DeWine has been issuing over the past month. And that is, be kind to each other. If you have to go out, then practice the social distancing. If you do cross state lines, like it's common from Detroit to Toledo, then quarantine yourself for the 14 days. And then the hygiene. And so I think if we practice all those things, we're going to continue to see this flattening of the curve. And this is something, of course, that we've never thought we would experience in our lifetime. And it's heartbreaking to see what's going on out there. And so a lot of people's coping mechanisms, might be going to their place of faith or some sort of social gathering. But now we can't do that. And so, and this weekend coming up with, a lot of religious celebrations that are just going to be smaller celebrations at home. So it's a difficult time, but the Doctors of Ohio are here for you. The Ohio State Medical Association is a resource for all physicians of Ohio. And I would like to personally and with the OSMA to commend, Governor DeWine, Lieutenant Governor Husted, and yourself, Dr. Acton, for what you've done. And, a shout out to my colleagues, to the nurses, of which one is my wife, and, to all the medical professionals and the support people who are out there on the front lines, and just to be safe, be healthy, and Ohio strong.
Thank you so much. I just want to thank you.